Since the rollout of the vaccination against the COVID-19 pandemic, there have been allegations concerning side effects of the Astrazeneca vaccine, something that experts think is responsible for the slow uptake of the exercise. Reports of some countries abandoning the use of the Astrazeneca vaccine allege that the vaccine leads to loss of sexual appetite and blood clots. However, while updating the nation on the ongoing vaccination exercise, a team of health experts led by Dr. Jonas Waldemariam, the World Health Organization country representative, qualified the efficacy and efficiency of the Astrazeneca vaccine.
People say it affects their libido and their sexual behavior, their potency. No, it doesn't. It doesn't, and this has not been seen as one of the side effects or adverse effects in probably by now 100 million people who have received the vaccine.
Dr. Jonas also explains reasons responsible for Uganda's choice for Astrazeneca over the other vaccines.
Looking at the three vaccines, their nature and the logistics they require was different. While Astrazeneca can be stored in a normal fridge, the Moderna and Pfizer would require a special freezers, which go into -20 and -80 respectively. So it is, on one hand, it was a decision of how easy it would be to ensure that with the investment done in Uganda that we can reach most of the people. But this is not a compromise on safety or quality.
The director, Uganda Virus Research Institute, Dr. Posian Caleb, says Uganda's journey to develop own vaccine is on course. Meanwhile, the Ministry of Health has revised prioritized groups for vaccination to include and cater for a bigger population. The Assistant Commissioner, Vaccines and Immunization, Dr. Alfred Driwale, says this decision is intended to accommodate more Ugandans. So far, close to 90,000 people have been vaccinated, with health workers in the lead, followed by security officers, while teachers are reportedly taking a back seat in the exercise.
The aim of vaccination is to protect the older people who are at home and the teachers, so that even if the children are transmitting the disease, it will not result into death. So if the children are moving from school, they go home, they see their older parents, their grandparents, they will infect them, and there we will see the deaths, we will see the severe forms of disease. But our assumption is that by opening up vaccination and protecting these older groups, both teachers and parents, the transmission of the disease will continue in the population of the school children without creating the effect of congesting healthcare facilities, people having severe forms of disease, and death.
The Dean of Makerere University School of Public Health, Professor Rhoda Wanyenze, reminds the public about the importance of continuing to observe standard operating procedures. She categorically says, much as the ongoing vaccination process might interrupt acquisition and transmission of the virus, it remains vital for one to keep guard.
We have increasing evidence that the variants might compromise the effectiveness of vaccines. Yes, the vaccines are still effective, even on some of these variants, but still it could compromise them. So we are not yet there. And because we have several emerging variants across several countries that have caused second and third waves, we must continue to do this.
At the beginning of March, government received 964,000 doses of AstraZeneca vaccines, a donation from the COVAX facility and the government of India. According to plan, for starters, an individual will get a single dose with the hope that the second doses will be administered after the arrival of more doses sometime in May and June this year. Dorcas Kimono, UBC News.